Hello everyone, I'm Dr. Adam Maulana. How are you today? I hope you and your family are always blessed with good health, peace of mind, happiness, and protection in everything you do. Thank you for taking the time to be here and learn with me. For me, every person who seeks health information is someone who is showing genuine care for themselves, and that deserves to be respected and appreciated. So, let us discuss today's topic calmly, wisely, and without unnecessary fear. Today, we will discuss an important question. Can certain medications be associated with tinnitus or ringing in the ears? As part of this discussion and observation, the source video comes from Clinic al-Beruni. I, Dr. Adam Maulana, will provide an explanation from an ear health perspective so that we can better understand the possible relationship between medication use and tinnitus. Tinnitus is the perception of sounds such as ringing, buzzing, whistling, hissing, or other noises even though there is no corresponding external sound source. It may be temporary or persistent, and the level of discomfort can vary from one person to another. One factor worth considering is the use of certain medications. Some medications are known to have the potential to affect the auditory system. The term often used to describe these effects is ototoxicity, meaning that certain medications or substances can influence the structure or function of the inner ear or auditory system. However, I want to emphasize one important point. Not everyone who experiences tinnitus after taking medication can automatically conclude that the medication caused it. The relationship between a medication and tinnitus needs to be evaluated carefully. Doctors may consider the type of medication, dosage, duration of use, the patient's overall health, other medications being taken at the same time, and when the tinnitus first appeared. One example is salicylates such as aspirin, particularly when used at higher doses. Under certain circumstances, these medications may be associated with tinnitus. In many cases, the symptom may improve as the medication's effects decrease, but any change in medication should always be made according to medical advice. Another group is nonsteroidal anti-inflammatory drugs, or NSAIDs. Certain medications in this group have also been associated with tinnitus or changes in hearing in some people, particularly under specific conditions of use. There are also aminoglycoside antibiotics, such as gentamicin and amikacin. These medications have ototoxic potential and, in certain circumstances, may affect hearing or the balance system. Their use therefore requires appropriate medical consideration and monitoring. Some chemotherapy medications, including cisplatin, are also known to have the potential to affect the inner ear. Patients receiving certain treatments may require hearing monitoring based on their doctor's assessment. In addition, certain loop diuretics, such as furosemide, may be associated with changes in hearing or tinnitus under particular circumstances, especially with high doses or certain medical conditions. So, what should you do if tinnitus appears after taking medication? First, do not panic. Second, and equally important, do not suddenly stop taking the medication without consulting your doctor. Medications are prescribed to treat specific health conditions. Stopping them without professional guidance may create other risks, particularly when the medication is necessary to control an ongoing medical condition. Instead, make a note of the medication's name, dosage, when you started taking it, and when the tinnitus began. This information can help your doctor or pharmacist assess whether there may be a connection between the medication and your symptoms. Your healthcare professional can then determine whether the medication should be continued, adjusted, replaced, or used with additional monitoring. This decision should always be based on your individual medical situation. Further evaluation may also be appropriate if tinnitus persists or becomes increasingly bothersome, especially if it is accompanied by hearing loss, dizziness, balance problems, or sudden changes in hearing. In such situations, an ENT specialist can evaluate the condition of the ear and hearing system. A hearing test may also be recommended when appropriate. So, in conclusion, certain medications can indeed be associated with tinnitus, but the relationship is not always straightforward. Not every case of tinnitus that occurs after medication use means that the medication is the cause. Many other factors need to be considered. That is why we should not automatically believe that one particular medication will cause tinnitus in everyone. At the same time, we should not stop necessary treatment simply because we read something about medication side effects online. As a final message, let us learn to approach our health not with fear, but with knowledge and wisdom. When our bodies give us a signal, listen calmly. When you have concerns about a medication, discuss them with a qualified healthcare professional. Do not ignore your body, but do not judge it too quickly either. Care for yourself patiently, seek accurate information, and make health decisions wisely. Because protecting our health is not only about avoiding illness, it is also about appreciating and respecting the life we have been given.